welcome to today's COVID-19 update New Brunswick. Bonjour tout le monde et bienvenue à cette mise à jour sur le COVID-19 au Nouveau-Brunswick. Les porte-paroles aujourd'hui sont le médecin hygiéniste en chef, le Dr. Jennifer Russell, et l'honorable Blaine Higgs, Premier ministre du Nouveau-Brunswick. Speaking on behalf of the province today are Dr. Jennifer Russell, the province's Chief Medical Officer of Health, and the Honorable Blaine Higgs, Premier of New Brunswick. Dr. Russell.
Thank you, Bruce. Merci, Bruce. Je vais essayer de ne pas soupir. Bon après-midi à toutes et à tous. Good afternoon, everyone. Nous faisons des progrès constants vers la phase d'alerte verte. Au cours des 2 derniers jours, nous avons franchi 2 étapes importantes dans notre campagne visant à protéger la population du Nouveau-Brunswick contre la COVID-19. Mais nous ne pouvons pas nous arrêter maintenant. We are making steady progress on our path to green, and in these last few days, we have passed 2 important milestones in our campaign to protect New Brunswickers against COVID-19. But we can't stop now. We must keep going so that we get as many New Brunswickers fully vaccinated as quickly as possible. Until this is done, we cannot let our guard down. Public health guidance and advice remains in place, and we all must follow these recommendations. Nous devons continuer à travailler pour assurer la sécurité de nos familles et nos collectivités. Nous ne pouvons pas passer à la phase d'alerte verte du plan de rétablissement avant que la vaste majorité de la population, tant les jeunes que les personnes âgées, soient vaccinées au complet. We can't move to the green alert level in our recovery plan until the vast majority of our population, both young and old, are fully vaccinated. The sooner we get there, the sooner we can remove the remaining restrictions. Right now, as Premier Higgs mentioned, anyone who received a first vaccine dose prior to May 1st is eligible to receive a second dose, and I'm greatly encouraged by the response we have seen to date. It is quite exciting. Next Monday, every New Brunswicker who has received their first shot will be able to get their second, so long as there has been at least 28 days between appointments. Pour le moment, comme le Premier ministre Higgs va mentionner, toute personne qui a reçu une première dose du vaccin avant le 1er mai est admissible à une deuxième dose. Je suis extrêmement encouragée par le taux de participation que nous avons constaté jusqu'à présent. À compter de lundi, chaque citoyen du Nouveau-Brunswick qui a déjà reçu une première dose du vaccin sera admissible à recevoir sa deuxième dose si au moins 28 jours se sont écoulés depuis l'administration de la première dose. The federal government has provided us with vaccines sufficient to fully vaccinate our population within the next several weeks. Also very exciting news. To move us down our path more quickly, I am asking everyone to be flexible in their choices of vaccines. And as I mentioned yesterday, the mRNA vaccines that we are using, manufactured by Pfizer, BioNTech, and Moderna, are completely interchangeable as recommended by NACI, the National Advisory Committee on Immunizations. And I think in terms of what people have been hearing and are more familiar with, because we had more doses of Pfizer early on, the majority of the population was very comfortable hearing about Pfizer as an mRNA vaccine. But because we didn't have as many doses of Moderna, it wasn't something that was in our vocabulary as much and in our ears in terms of media. So what's exciting is that we have more doses of Moderna coming, and we would really like to continue to use those vaccines interchangeably because it is safe and effective to do so. They work the same way. They are equally effective separately or in combination with one another. So during the first phase of our vaccine effort, Moderna vaccines, as I mentioned, were in short supply. And most of the doses we provided were actually Pfizer vaccine. But since then, Moderna has addressed its supply issues, and Canada will now be receiving millions of Moderna doses. So New Brunswick will get 175,000 doses of Moderna over the next 2 weeks. And there are 82,000 New Brunswickers who received Moderna as their first dose who are still waiting for their second dose, and my son happens to be one of them. So if you received a Pfizer product in the first round, you can have Moderna for your second dose. And this means that you can receive your second dose more quickly as a result of this extra shipment of Moderna, offering you more protection sooner, protecting our communities, and helping our province reach the green level. As the number of fully vaccinated New Brunswickers increases, and as travel restrictions and border measures are eased, we do expect there may be, in fact, an increased number of COVID-19 cases in New Brunswick as people begin to travel more. And this is contrary to what you might be anticipating. So I'm just trying to prepare people for the idea that we could see an increased number of cases. But remember, we have been so fortunate in keeping our case numbers low due to our border measures. When we open up for more movement of people in and out of the province, we will likely see more cases here in New Brunswick. But the good news is that more of our people are getting vaccinated every single day, which means more people are protected. So this, along with the continued testing and early identification and management of cases, will provide a new layer of protection against the virus and allow us to prevent our healthcare system from being overwhelmed, as we have succeeded at doing throughout the entire pandemic. So we do expect that if we do see an increased number of cases, that the majority would be people who have been vaccinated, obviously, which means that they would either have no symptoms or they'd have very mild symptoms, because the protection that the 2 doses of vaccine offers means that they have much, much lower chance of being hospitalized or being admitted to ICU. So COVID-19 is still with us and will continue to be with us for some time to come. So we must all remain vigilant to slow the spread of the virus. Aujourd'hui, Santé publique confirme qu'il y a 3 nouveaux cas de COVID-19 au Nouveau-Brunswick. Il y a un nouveau cas dans la zone 1, soit la région de Moncton et du sud-est du Nouveau-Brunswick. Dans la zone 3, soit la région de Fredericton et de la vallée de la rivière Saint-Jean, il y a un nouveau cas. Il y a aussi un nouveau cas dans la zone 6, soit les régions de Bathurst et de la péninsule. Ces 3 cas sont des contacts de cas déjà confirmés. Today, Public Health has confirmed 3 new cases of COVID-19 in New Brunswick. In Zone 1, which is Moncton and southeast New Brunswick, there is 1 new case today. In Zone 3, which is Fredericton and the St. John River Valley, there is 1 new case. There is also 1 new case in Zone 6, which is Bathurst and the Acadian Peninsula. Each of these is a contact of a previously confirmed case. There are now 58 active cases of COVID-19 in New Brunswick. This is the lowest number of active cases we have seen since mid-March. We have 6 individuals in hospital due to COVID-19 at the moment, and these include 2 who are under intensive care. And I ask you again that you keep everyone whose lives are being disrupted by COVID-19 in your thoughts and in your prayers as you go about your day. Every phase of our pandemic journey has come with difficulties. But many of you will find this next phase particularly challenging and probably a little bit anxiety-provoking. With more people moving within New Brunswick and from outside the province, there will be new opportunities for the COVID-19 virus to spread. And as you know, we have new and more contagious variants that will increase the risk of outbreaks among those who are unvaccinated or partially vaccinated. So at the moment, we are all ready to enjoy a less restricted life. And it is more important now, more so than ever, to take care to not unintentionally spread the virus. En attendant d'atteindre la dernière étape du processus menant à la phase verte, nous devons tous continuer à porter un masque en public. Nous devons tous continuer à maintenir une distance d'au moins 2 mètres les uns les autres. Nous devons tous continuer à nous laver les mains régulièrement et soigneusement et utiliser fréquemment un désinfectant pour les mains à base d'alcool. On a pratiqué beaucoup dans les derniers 16 mois. Until we get to the final stage of our path to green, we must all continue to wear a mask in public places. We must all continue to maintain 2 meters of physical distance from others. We must all wash our hands regularly and thoroughly and use an alcohol alcohol-based hand sanitizer between washings, and we've had a lot of practice doing this in the last 16 months. We must all continue to watch for symptoms of COVID-19 in ourselves and our families. And when symptoms emerge, please don't take chances. Please get tested. What might appear to be a summer cold could actually be COVID-19. We really do have to keep a high level of suspicion for the foreseeable future. With each passing day, we are reducing the risk of new outbreaks of COVID-19 in New Brunswick, but we will not be able to eliminate that risk entirely while there still is a global pandemic happening. In the weeks ahead, we all need to remain vigilant. We all need to keep doing what we have been doing for the last 16 months. And we all need to get fully vaccinated as quickly as possible. We are well on our way to green. Let's make sure we get there together, healthy and safe. Thank you very much.
Good afternoon. Bonjour. Because of the strong uptake in vaccinations, low hospitalization, and continued adherence to public health rules, we are able to fulfill our commitment to move to phase 2 earlier than we had thought possible. New Brunswick is indeed on the move and coming back quickly. As of today, 20.2% of New Brunswickers aged 65 and older have received their second dose of COVID-19 vaccine. That, coupled with our announcement yesterday that 75% of New Brunswickers aged 12 and older had received their first dose of vaccine, is indeed great news. The first dose number continues to rise as well, reaching 75.4% today. De plus, le nombre de personnes hospitalisées reste faible et toutes les zones sanitaires de la province sont en phase jaune. Nous sommes à cette étape grâce aux personnes qui se sont fait vacciner dès que cela leur était possible. Parce que vous avez pris des mesures pour vous protéger et protéger vos proches et vos communautés, nous pouvons assouplir davantage les restrictions. Effective as of midnight tonight, travelers from all of the Atlantic provinces, including all regions of Nova Scotia, will be able to come to New Brunswick without being required to isolate, and no travel registration is required for those in Atlantic Canada. Our border checks with Nova Scotia will be removed. We are once again glad to welcome all Atlantic Canadians with no registration. We are hopeful this will lead us to a full Atlantic bubble, which is expected by June 23rd. Canadian travelers with at least one dose of the vaccine will be allowed to come to New Brunswick without isolating. However, Canadian travelers from outside the Atlantic provinces must register in advance and have proof of vaccination with them when they arrive at the New Brunswick border. Les voyageurs canadiens non vaccinés pourront entrer dans la province, mais ils devront s'auto-isoler à leur arrivée. Ces voyageurs seront testés entre le 5e et le 7e jour. Si leur résultat est négatif, ils pourront cesser l'isolation. Per our phase 2 of the Path to Green, these same rules will apply to visitors from Maine once the federal government allows it. Once the federal government reduces restriction on international travelers under phase 2, all other international travelers who have only one dose who are unvaccinated will be required to isolate for 14 days and take a test on day 10 of their isolation. But international travelers who are fully vaccinated will not be required to isolate, again, once permitted under the federal rules. In New Brunswick, we are removing the requirement to isolate in a designated facility in phase 2. Tous les voyageurs provenant de l'extérieur des provinces de l'Atlantique devront continuer à s'enregistrer. Nous prévoyons que ce changement va faire en sorte que la circulation à la frontière du Québec vers le Nouveau-Brunswick va augmenter. On peut s'attendre à ce que cela entraîne des retards aux voyageurs. I know many of you have family and friends from outside of Atlantic Canada you have not seen for a while and who are eager to come here. To facilitate their arrival, please remind them to make sure they are registered for travel and to bring their registration with them as well as the proof of vaccination that they would have received from their healthcare provider in their jurisdiction. Recognizing there will be delays if you're able to travel outside peak times, such as during evenings or overnight, your arrival will be faster. Also, as of midnight tonight, rotational workers and their families no longer need to isolate. It's worth noting that rotational workers have a vaccination rate of 80%. Thank you for doing your part in these difficult times to keep our province safe. Also, in Phase 2, all businesses, restaurants, and schools can operate at full capacity. Restaurants and certain other venues, such as gyms and salons, need to continue to maintain a contact list for their patrons to assist public health in contact tracing if this should be required. Le port de masque sera encore obligatoire dans les restaurants et les bars, quand les gens ne sont pas en train de manger ou de boire. Les activités sportives organisées seront encore autorisées s'il y a un plan opérationnel. Cependant, les parties et les compétitions avec des joueurs et des équipes de l'extérieur du Canada Atlantique seront soumises à certaines exigences de voyage. A full list of requirements for this new phase can be found online on www.gnb.ca/coronavirus under COVID-19 alert levels. We have been living with this pandemic for so long that it's hard to believe that we're so close to reaching the green level. Nous sommes rendus à cette étape quand nous avons, ensemble, pris en considération la santé et de la sécurité de nos concitoyens de Nouveau-Brunswick. Currently, almost 13% of New Brunswickers 12 and over have received their second dose of COVID-19 vaccine. It is indeed exciting to see how many New Brunswickers are signing up for the second vaccine across all age groups. This has not only allowed us to reach our Phase 2 ahead of schedule, this continued activity could allow us to reach the green stage earlier than expected. Imagine getting more of summer without masks. Let's do this together. Let's reach our second dose criteria. Let's reach those percentages, the 75%. Let's make it happen where we're fully vaccinated, and let's do it sooner than we planned, just as we're on track now to do so. Earlier this week, we announced that anyone who had received their first dose of vaccine prior to May 1st was now eligible to book an appointment for their second dose. Beginning on Monday, June 21st, that will be expanded further to include all New Brunswickers 12 years and older once 28 days have passed since they received their first dose of COVID-19 vaccine. I encourage everyone to make an appointment for your second dose as soon as you're eligible. Green is closer than ever. Imaginez ce que nous pouvons faire dès que nous serons là. Nous pourrons retrouver notre famille et nos amis, des personnes que nous n'avons pas vues depuis le début de la pandémie. We can eliminate the last of restrictions we are still living in, including having to wear a mask once we reach the double vaccination levels and we have reached the ability for us to all be vaccinated at a level that helps us achieve success. We must continue to do so by following public health rules. We must be sure that we don't let our guard down as we continue to drive for green. And let's make this possible sooner than we plan, but let's not let our guard down now. Continue to follow public health rules, continue to wear masks, and let's regain more of summer than we thought initially possible by getting our second vaccine. We can begin to make plans for big trips and big events like weddings and family reunions. When we reach green, it is truly up to you. It is possible. We know that we're getting close. We know that we're better than we thought we could be, but we know how great New Brunswickers are. We are showing the rest of Canada, we are showing the rest of the world that when we get focused, look out, because we can be better than anyone would have believed. This is just the start. Working together, we will overcome this final hurdle. Thank you. Merci.
Well, thank you, Premier. Thank you, Dr. Russell. Merci beaucoup à vous deux. Nous allons maintenant procéder aux questions des journalistes. Vous avez le droit de poser votre question dans la langue officielle de votre choix. Chaque journaliste aura une question. Voulez-vous assurer de désactiver le son de vos micros? We'll now proceed with questions from members of the media. Each reporter will have one question, and you have the right to pose your question in the official language of your choice. please ensure your microphones are placed on mute. Vicky Hogarth, CHCO TV.
Thank you, Bruce. Premier Higgs, you mentioned being open to the idea of travelers from Maine. Dominic LeBlanc said yesterday that Canadians could expect to hear more in the coming days about a phased-in approach to reopening the U.S. border. And I understand you'll be speaking with the Prime Minister and the other premiers about this issue tomorrow. Can you give us an idea of what perspective you'll be sharing in this meeting and what kind of a realistic timeline we should anticipate for a border reopening and what potential phases of reopening could look like?
Well, certainly it will be one of the significant topics of tomorrow night's meeting. And in the last meeting we had, there was a lot of interest to open up the U.S. border, but recognizing that our vaccination levels had to get caught up. As you recall, we talked a lot about sharing vaccines from the U.S., but our availability of vaccines have certainly increased dramatically. And so we're able to not only, the pace, keep up the pace we currently have, but across Canada, we believe and can see that is happening as well. So I would guess that tomorrow night we'll be in a position that the federal government will probably want to see early in the summer, and sometime early in July at the latest. I know there's a commitment or a decision that has to be made for June 21st. So I guess it could be as early as that, but we're looking at, I would say, over the next 2 to 3 weeks that we would see some definite date being brought forward. And decision point, as I said, is June 21st for the federal government to decide the next step. And I guess that would certainly be the earliest. But over the next 3 weeks, I think would be kind of the longest period.
Thank you, Premier. Thank you, Ms. Hogarth. Jacques Poitras, CBC.
Hi, Dr. Russell. I've been speaking with some experts who are wondering about whether things are moving a little quickly now, particularly with Canadians with one dose being able to come into the province. That offers, as you know, only 30% protection against the Delta variant. So someone could be here in a couple of days and eat in a full capacity restaurant full of other people with just one dose. I know you said we'll have 2-dose protection, but there's a window coming up of a few weeks where a lot of people, a lot of travelers in the province will only have had 1 dose. So what is your assessment of the risk there?
Hi, Jacques. Great question. And I know probably lots of people watching and listening would be interested in really understanding the actual risks. And what we know is that we don't know everything. What we know is that we get new information every single day in terms of studies and research around the vaccine efficacy, et cetera. What we do know is that here in New Brunswick, our case numbers have always been a reflection of what has been happening elsewhere in Canada with respect to a proportionality of our cases being a reflection of what's happening in the rest of Canada. What we're seeing in the rest of Canada right now is those numbers are going down quite dramatically. We have the lowest numbers of cases, active cases in Canada, I think since the fall. And so again, that combined with the protection of people getting vaccinated all across the country, pretty much at the same pace. If you think about the per capita distribution of vaccines to all the provinces, we're all getting vaccinated pretty much at the same pace, give or take a few percentages here and there across the country. So with those two things and with the stringency measures that we've had in place throughout the pandemic compared to other places in Canada, we've been able to keep our hospitalization rates low. We've been able to keep our number of ICU admissions low. And we anticipate that we will be able to continue with that same level of protection of our healthcare system as we move forward. But time will tell, and we're going to do surveillance very, very closely. Testing will be very, very important. Continuing to follow public health measures will be very, very important. So there is nothing with the pandemic that is without risk. So we will never have zero risk, but we try to balance all of those risks with the social determinants of health, with the mental health of the population, and the sacrifices and hard work that New Brunswickers have done to get us to this point. And thank you all again for getting vaccinated to this point in time and signing up for your second doses, because that is what's going to continue to protect us moving forward.
Thank you, Doctor. Thank you, Mr. Poitras. Laura Brown, CTV.
Hi, Premier. I'm wondering, I just want to be clear, Atlantic Canadians don't necessarily need to be vaccinated at all in order to travel to Brunswick as of midnight tonight. So you're not planning on having people at the Nova Scotia border or Confederation Bridge. And if that's true, Canadians do need their first dose, and I'm wondering how you'll police that. Will they need to send you virtual copies of a vaccine certificate, or do you know if all provinces have been given those out?
Well, certainly anyone who's been vaccinated will have a vaccination, a record of that. So we're asking that anybody traveling into the province from outside and other provinces need to be registered, and they need their proof of vaccine. So outside of Atlantic Canada, that is the requirement across the country, and that's for anyone coming here from outside Atlantic Canada. So that will still be a diligent process for us to follow, just the same as we have been all along. And if you can't provide those that proof, then there will be full isolation requirements in order to ensure that we are keeping everyone safe. So that process won't change in terms of scrutinize who's coming, and the fact that they have at least one dose, and the fact that they have actually have a certificate that reflects that.
Thank you, Premier. Thank you, Ms. Brown. Pascal Rachnog, Radio-Canada.
Bonjour, ma question est pour la Dr. Russell. On a remarqué aujourd'hui que le taux de vaccination pour les 12 ans et plus a seulement augmenté de 0,2 points de pourcentage depuis hier. C'est pas beaucoup. Depuis le début de la vaccination, on a vu parfois des sauts de 1% ou plus. Pourquoi pensez-vous que ça avance plus lentement en ce moment et qu'est-ce qui peut être fait différemment pour aller plus vite là, au cours des prochains jours?
Excellente question. C'est vraiment important que tous les gens soient vaccinés et les jeunes sont inclus dans cette but. Il y a des changements qui ont été faits depuis le commencement du déroulement du programme d'immunisation. Au commencement, c'était vraiment des rendez-vous, soit avec les réseaux ou soit aux pharmacies. Mais à fur et à mesure qu'on faisait partie des discussions avec le département d'éducation, il y avait la possibilité d'avoir du transport pour des étudiants. Alors ça a aidé aussi. Mais je sais que c'est un temps un peu occupé pour des gens en ce moment-ci, à la fin de l'année scolaire. Mais c'est très, très important que les jeunes soient protégés autant que les adultes. Alors, il y en a encore des cliniques dans différentes parties du province sans rendez-vous. Alors, ça, c'est une autre façon que les gens peuvent être vaccinés.
Merci, M. Rachnog. Ailish Penang, CTV.
Thanks, Bruce. Premier, building off of my colleague Laura Brown's earlier question, what sort of measures are actually going to be put in place to prove the validity of the vaccination records for travelers at the borders? And will those requirements be different for Atlantic Canadians versus domestic and international travelers?
I guess in terms of international travelers will be a discussion that we'll agree with the federal government of how that's going to work and how we're going to be able to monitor the actual certification levels and registration levels and ensure they're valid. In the case of domestic travel, provinces across the country have been moving about prior to COVID, and we've or during COVID, but we've certainly kept the Atlantic region as almost separate. But at this point in time, as Dr. Russell states, the level of vaccinations are high across the country. We'll be discussing, as we have, vaccination passports. I don't see that there's going to be a lot of uptake for that. So we are relying on individuals when they come to present their their valid registrations. Yes, and I understand, maybe it can be duplicated or copied or forged. But as Canadians, we have been protecting each other. But I think the important note here is that we feel that we're at a level here in New Brunswick of vaccinations that our population is protected. And that's the goal in all of this, is that we can open up, have family, friends, once again return to our province and allow property owners back into our province. But we continue to follow the public health rules and guidelines. That's why those don't change in relation to masks, in relation to distancing, in relation to washing hands, in relation to the protocol. That cannot change until we have all reached our double dose vaccination levels. So our protection is how well we look after our population in order to ensure that they are protected from travelers. And that brings to the point, getting the second dose quickly. I think what we have here is the opportunity, and maybe the momentum of the ability is there for us to be vaccinated and move summer forward without masks. But we can't do that, and I can't put a date on that until we've reached that level percentage level for the double dose of vaccines. But the quicker people get it, we have the vaccines, we have the duration of timeline required between doses. But if people stick to that and we move along here at the rate that we have vaccines available, we'll be in good shape a lot sooner than we had originally projected. And we will be able to go green without the limitations and requirements. But until then, our protection has to be around following closely public health guidelines.
Thank you, Premier. Thank you, Ailish. Silas Brown, Global TV.
Hi there. This is for whoever would like to take it. Throughout the pandemic, the government and public health have assessed changes in phase level, in alert level, to various different tweaks to, outbreak responses on a 2-week rotating basis, the incubation period of the virus. Why abandon that now when we're making the biggest move to actually open our borders to the rest of the country? Why abandon that cautious approach of assessing what each phase means and what result it has for a 2-week incubation period cycle?
Silas, can you get a little closer to your microphone? We caught part of it, so if you could do a quick...
I caught it.
Oh, the doctor caught it.
Yeah.
My apologies, Silas.
So the question that Silas was asking that was really hard to hear because the volume was really low, was around, with many different phase changes throughout the pandemic, we've tried to keep around 2 weeks, plus or minus, depending on the situation, because the incubation period of COVID-19 is 2 weeks. We didn't always use 2 weeks. There are countless examples of different phase changes that we did that were longer than that or shorter than that. Again, based on the data, based on the surveillance information that we had at that time. And again, based on hospitalization capacity and other triggers in terms of contact tracing and testing, et cetera. So right now, because we are in a good place, there's no question about the success that we've achieved with keeping our case numbers low and keeping our hospitalization rates with COVID low, that we know that with the vaccine, the protection is there. We're not eliminating all public health measures in terms of masking and physical distancing and hand washing. So there will be more protection from the vaccine. There will be the existing protection of those layers that we're not changing in terms of masking and hand washing and physical distancing. And the change with respect to the risk of travel imported cases, that's where that calculation in terms of risks and modeling comes in around the proportion of cases that have always existed in terms of imported cases to New Brunswick, but being a reflection of the overall numbers across Canada. Those numbers are decreasing dramatically at this point, Silas. So because all of Canadians are getting vaccinated pretty much at the same rate, again, I know there are some provinces ahead of others, but for the most part, the percentage of the population across the country is quite good and is going to continue to increase with second doses in all provinces. So there's a level of safety and protection with the vaccines that wasn't there before. So, and we know that the vaccination rollout will be protecting us against hospitalizations and severe symptoms of COVID. We do expect to see cases rise potentially. And we're not worried about that so much in the sense that we know that that case number will include a lot of people who are vaccinated, who won't have symptoms, or if they do have symptoms, they're very mild and they won't require hospitalization. So it looks like, based on, again, the evidence and the data that we have, that we could maintain and sustain the same hospitalization rate and ICU admission rate with decreased restrictions and decreased border measures, because the vaccines offer so much protection. So that is where we are right now. And if things change, because we're going to be following this very, very closely, we'll make adjustments as we need to protect our hospital system.
Thank you, Dr. Maude Montembeault, Radio-Canada.
Bonjour. Ma question pour Dr. Russell. Hier, vous avez dit qu'il y avait quand même une condition, celle de s'enregistrer. Pourriez-vous expliquer aux Canadiens qui voudraient visiter Nouveau-Brunswick pourquoi c'est important de s'enregistrer? Parce que pour certains, ça pourrait peut-être être vu comme un frein pour les empêcher de venir visiter Nouveau-Brunswick. Alors, pourquoi c'est important quand même de le faire?
Alors, pour inscrire, pour venir visiter la province, c'est une des choses qui offre un niveau de protection encore, parce qu'il faut faire encore de la surveillance. Il faut vraiment faire certaine que les gens se sont vaccinés, parce que sinon, la façon qu'ils doivent faire leur auto-isolement et leur dépistage est différent. Alors, c'est pour ça, à ce moment-ci, pour la protection de la population, parce qu'on a la majorité avec un dose à ce moment-ci. On attend pour la majorité d'avoir leur deuxième dose. Et en attendant, il faut continuer à protéger la population du Nouveau-Brunswick avec tous les différents niveaux et différentes sortes de protection qu'on peut à ce moment-ci en changeant les mesures aux frontières et changer les mesures au niveau des restrictions de voyage.
Merci, Maude. Merci, Dr. Hadil Ibrahim, CBC.
Thank you. This question is for Premier Higgs. Dr. Russell. Looking forward to complete reopening. Now that we reach 75%, how important is it still for unvaccinated people to get their first dose? And what do you have to say to people who can get vaccinated but think they don't need to now that we reached this 75% number?
I think they still need to, Hadil. I'm very concerned about people who aren't vaccinated right now, and I will continue to be concerned about people who aren't vaccinated, because we know based on the data that those people will be most at risk of severe symptoms, most at risk for hospitalization and ICU admission, and most at risk for dying. And with the variants of concern, this is going to continue and perhaps even get worse. So the more protection we have, the more people are vaccinated, the better. I don't want to hear about people after the fact that were admitted to hospital with very severe symptoms because they for whatever reason chose not to be vaccinated. So whatever we can do as community members, as family members, as friends and colleagues to support one another to get vaccinated, whether it's helping somebody get their online appointment. I had somebody text me right now saying they called public health. Well, they need the link to phone to get a vaccine online through the RHAs, or they need to phone their pharmacy. Some people need moral support and encouragement. They need a ride. They need transportation. They need company to go with them. And some people need to sit down and talk about their fears, because some people are very afraid of needles. We do have places in the RHA clinics where you can have a private space to get your vaccine in case you are one of those people who has a lot of anxiety and may pass out if you have a vaccine, a needle. So there are many things that can be barriers. There are many things we can do to address those barriers, and I would really like everybody in this province to do whatever they can to help remove barriers to getting vaccinated right now.
Thank you, Hadil. Thank you, Dr. Bobby Jean McKinnon, please. Bobby Jean.
I'm sorry. Hello, can you hear me?
Louder and go for it.
Okay, sorry about that. Premier Higgs, Nova Scotia Premier Ian Rankin said yesterday he would ideally like to see all 4 Atlantic provinces allow regional travel for some time before opening up to the rest of Canada on the same date. He also said he wouldn't take any undue risks with Nova Scotians' safety. So how do you respond to that, and what might this mean for New Brunswickers who want to visit Nova Scotia?
Well, I think the statement's already been made in relation to the 23rd. We'd had this discussion about a week ago in relation to opening up the Atlantic bubble and potentially to the rest of Canada, but the 23rd was a date for the Atlantic bubble that they would feel comfortable with. I outlined the fact that I had already made a commitment. We had worked through our opening phases, and if the people of the province New Brunswick actually achieved these levels, and then I had an obligation to keep going, which certainly is what we're doing. I know that we have been the the gateway to the Atlantic region and I guess guarded that gateway with the perimeter provinces, I guess, in relation to Quebec and Maine. And we'll continue to do that even with this opening. We continue to have a situation where we'll be requiring registrations. And I guess if the individual Atlantic provinces want to go further than that, I mean, that would be certainly up to them to do so. But I don't think that will be necessary for the most cases. And I know tomorrow night it's going to be a discussion about opening up with all of Canada. So I guess, you know, we put a schedule forward that is driving our announcement today and the one yesterday. The people of New Brunswick have really responded, and to get to the second level and second doses, or third level rather, in the second dose of vaccines, there's an added, you know, certainly criteria and an added benefit to do so. And I think the Atlantic provinces are all in the same boat in that regard. So I just think we're only talking a couple days or a couple weeks at the outside here when we could have a little difference of situation in each province. But we're all going to get there, and I know Premier Rankin wants to be in the same place in order to open up to the rest of Canada. And I think, as Dr. Russell's outlined, and certainly as we've met as a COVID cabinet committee, we don't feel we're putting the citizens of our province under any risk at all that can't be managed within the realm of COVID. We're just recognizing the great work they've done to get us to this stage, and the great work we're confident they will continue to do to keep us safe by continuing to follow the rules and to be vaccinated at unprecedented levels that's leading the country. So I'm proud to be a New Brunswicker and be working on the best regards to see our province move forward.
Thank you, Premier. Thank you, Ms. McKinnon. Isabelle Arsenault, Radio-Canada. Aaron Sousa, Huddle Today.
Thank you, Bruce. This question can either go to Dr. Russell or the Premier. I was speaking with someone from the Moncton Airport today, and they told me that they're now offering COVID tests within their facility for travelers leaving New Brunswick, and that it's completely independent of the province. So I'm wondering, as we start to loosen these restrictions, I'm wondering if there'll be any sort of mandate from public health to offer on-site COVID tests at these airports for travelers coming in and out of the province.
So as of right now, the testing that's happening at that airport, my understanding again is that the airport had hired a private company to do that testing. With respect to any international travel, that falls under federal jurisdiction. So we wouldn't really have a role to play there. However, within our province, we will still have testing available for travelers. Testing will continue to be a very important part of how we maintain low case numbers and low hospitalization rates moving forward throughout the different phases. So we will continue to have workplace testing, and people should plan accordingly around these things.
Thank you, Aaron. Thank you, Dr. Erica Butler, CHMA, Sackville.
Hi there. Hope you can hear me okay.
Perfectly.
Oh, great. This is for Premier Higgs. You've mentioned the goal, is to get second doses very quickly. Here in Sackville, there are no more Vitalité vaccination clinics scheduled. We're going to be a month without any until mid-July. I'm just wondering, is the vaccination rollout scaling back or centralizing in other parts of the province as well? And if so, do you have concerns that that will slow down the province being able to hit that target for August?
Well, we're certainly not scaling back. So any sort of the fact that the clinic's not available in Sackville until mid-July would be news, and I'm sure it'll be something that we'll discuss later in the evening about where our clinics are, because we're ramping up as vaccines are available, which they are now. We're ramping up, and that means all over the province. So This news to me about Sackville, and certainly I'll be looking into that because we know that pharmacies across this province have vaccines available to them. So I would anticipate that the pharmacies are able to maintain and keep up to any sort of requirement. I think we have like 213 pharmacies that are in this mix, and certainly that would include Sackville. So maybe they're thinking the demand, they can manage it through the pharmacies, but I will ask that question later. You know, when I think about the rollout and ramping up, with the number of vaccines, first doses that have been administered, and we're now at like almost 76%, you know, these folks have obviously decided that, you know, they want to get a vaccine, they want to be protected, and they want to be part of the solution. So I'm very confident that they're going to come forward to complete the process. It's really, we will make vaccination clinics available, and I will look into this one particularly, but I would guess the pharmacy must be taking the role there.
Thank you, Premier. Thank you, Erica. Tom Bateman, Brunswick News.
Oh, hi there, Dr. Russell. You mentioned that some people might be surprised by the increase in cases that you anticipate as we open up to more travel. Can you tell me what the upper limit of an acceptable caseload is for you as we, you know, open up more? And what would trigger you know, more restrictions or scaling back our reopening plans? Thank you.
Great question, Tom. So throughout the pandemic, you could see a percentage of our case numbers that ended up having to be hospitalized with the wild type variant. So the last big outbreak, the first outbreak this particular year in January in Zone 4, that was the wild type variant, and I think there were about 200 plus cases at that, you know, at the peak or more, and we had 20 hospitalizations, over 13 ICU admissions, and that was probably the biggest burden at that time. With the vaccination rates as high as they are right now, it is possible that we could see higher case numbers, but if lower number of people requiring hospitalization and ICU admissions, because if the cases are occurring in people who are vaccinated, we expect them to be either asymptomatic or have very mild symptoms. So as you know, again, the second dose gives more protection than the first. So we are really keen to get everybody vaccinated with their second dose as quickly as possible. We have the capacity, we have the doses with the extra shipments of Moderna. So now is the time to book your appointment. And you know, I don't think it's possible to completely accurately describe the exact number of cases that we would need to see before we would be beyond that threshold, but that's why we're still going to be monitoring hospitalizations and ICU admissions and hospital capacity very, very closely, and it is important for people to continue to get tested even if they have mild symptoms.
Thank you. Rachel from allnewbrunswick.com. Can we cycle back after?
Sure.
Savannah Odd, Telegraph Journal.
Hello, can you hear me okay?
Perfectly.
Okay, my question's for the Premier. It seems that the long-term care vaccination rate for workers has increased pretty significantly to herd immunity with one dose at least. But there are still 23 homes with less than 50% of staff vaccinated. So I'm wondering if you think this is enough progress for the sector, and will you be looking at any next steps to increase rates at those 23 homes?
Well, it's been a topic, and we've been monitoring the success in that area for the past, I guess, 4 weeks or so when it first came up. And it'll be another item on the agenda, so I'll get an immediate update tonight and with our COVID cabinet committee. But the rate, to your point, has gone up significantly. And while there are a certain percentage of homes that are, let's say, not where we'd want them to be just yet, I think we'll go through tonight where the risks are, and we feel that the risks are low at this stage because of the level of change in the past 4 weeks. But I will have an update on that tonight, and I guess we'll decide if any further measures are required. Because we had looked at mandatory testing, and the employers of those facilities could, in fact, administer that if it was seemed necessary. Our social development department have been working closely with the conditions there and adhering to an improved, I guess, level of vaccinations, which we have seen. So at this stage, I'm not planning on any additional changes other than to continue to encourage more vaccinations at the facilities, and it will be a point of discussion tonight.
Thank you. David Caron, l'Acadie Nouvelle. Okay. Doctor, you'd like to return to Tom Bateman's question?
Yes, yeah. So again, calculating what that upper number will be, it's not, 100% in terms of being able to predict that. But again, we're going to watch those numbers. And there's a recent study from England and Scotland around some healthcare workers that became positive for COVID. And they looked at the Delta variant and the Alpha variant. And the number of people that had 2 doses of any of the vaccines, there were probably between 6,000 and 8,000 people that were healthcare workers. Then in that, there were about 600 plus that got COVID-19. Of those 600, about 60 some needed hospitalization, and I think only 3 needed ICU admission, and none of them passed away. So those kinds of studies are helpful. Modeling is helpful, but at the end of the day, we will be monitoring our hospitalization capacity very, very closely throughout all of these changes.
Thank you. Did you want to get to the travel?
Oh, yes.
And to Aaron Sousa, doctor has more information concerning travel.
So with respect to travelers needing a PCR test for travel, they can access a test at any local assessment center. We do advise travelers to please plan ahead to meet guidelines based on test results prior to flight. Any domestic or international travel requirements are under the federal jurisdiction, not provincial. So the federal government has instituted the testing measures for flights, and we don't have any further information on what is being planned based on easing of restrictions. So the requirements for COVID-19 border entry are set independently by each country. New Brunswick offers a robust testing program that can assist travelers to meet these requirements, and it is up to the traveler to ensure they are aware of the entry requirements of their destination and fulfill these needs through the private and or public offerings available.
There we go.
Yeah.
Thank you. Ladies and gentlemen, that concludes today's update. Voilà la fin de notre mise à jour. Merci beaucoup. Thank you.